Hi there, my name is Justin Smith. I'm a medical student and I'm also a type 1 diabetic. Today I'm going to talk a little bit about insulin pumps and closed-loop insulin delivery systems. So these are things that your patients are going to have in the management of both type 1 and type 2 diabetes. So the cool thing about insulin pumps is that they're exactly what they sound like. They're pumps that are continuously giving your patient insulin subcutaneously. How that gets in there to the patient subcutaneously, there are sites that the patient will insert and change about every 2 to 3 days. So you usually see those in the abdomen. They're going to be either a needle or a cannula right underneath the skin that's going to provide that pump a way to deliver that insulin 24/7. Now, something else you're going to see is an insulin pump that's going to be used in conjunction with a continuous glucose monitor. And what a continuous glucose monitor is something that a patient, again, inserts underneath the skin. It's a subcutaneous sensor that they change about once every 1 to 2 weeks. And those are going to give real-time blood sugar values to give real-time data to direct insulin delivery. Whenever you combine the continuous glucose monitor with the insulin pump and those talk together and work, that technology is what they consider a closed-loop insulin delivery system. So insulin delivery is going to be titrated up or down based on what the blood sugar values are at that time. So if blood sugars are trending upwards, insulin delivery is going to be increased. And if blood sugars are trending downwards, obviously insulin is going to be decreased in order to maintain that steady blood sugar value. So one of the best parts about real-time insulin delivery being titrated up and down is ultimately the better control that diabetic patients have. There have been studies that have shown significant increases in diabetes control that have been evidenced by changes in their A1C, and I personally can also attest to that. So my A1C used to be around 7 before I went on the closed-loop system. Now I usually am around 6.4, which is obviously a well-controlled diabetic patient. So that's great news for me. Also, it's great because there's a lot more hands-off approach to diabetes care. There are still times when I have to direct it, like at meal times, and also whenever my blood sugar might be too high or too low for the automatic system to kind of correct it by itself. But other than that, I really do have more of a hands-off approach and have the ability to focus on living life, studying, or doing whatever else it might be. So obviously this technology wasn't here 4 years ago, and in 4 years I don't know what the technology is going to look like. It's going to be awesome to see, but as a result, this is really exciting advances in the care of diabetes and in the care of your diabetic patients.